My name is Peter Wright. I'm the president of Bridgton Hospital and Rumford Hospital. When I graduated college, I was in a variety of different industries before I discovered healthcare, and that's really when I fell in love with my work and figured out what my calling was. I started at Copley Hospital. I was a director of planning, development, and medical group operations. And then I moved to Littleton Hospital, where I was the chief operating officer. And then most recently, the president and chief executive officer of Valley Regional Healthcare. All the hospitals I've worked at are critical access hospitals. They're all in rural areas. And so I truly do understand the needs of small rural communities in northern New England. It's what I've been doing my entire career. And I understand how those needs are very, very different than what you see in larger areas, and that how critical access hospitals, how they run, is very different from larger tertiary care centers. I was very excited about the opportunity to come to Bridgton and Rumford hospitals. I've watched these two hospitals for many, many years and truly believe in how they provide care. They're very well known for providing very high quality care. They're very well known for being low cost, and they're also very well known for being beloved by the communities that they serve. And so when this opportunity came about, I jumped on it right away. We have family in Maine. We have a lake house in Maine, and this opportunity came faster than I thought it would. I figured I'd be searching over here a little later in my career, so both my wife and I and our entire family were very excited that it came a lot sooner. Healthcare is people taking care of people, and healthcare is very local. And so my vision for the two hospitals is to be able to provide as much care as possible close to home. Right? People don't want to drive an hour to get care. People don't want to go to a big center. Community hospitals are just that. They're part of the community. We don't take care of patients. We take care of our friends and our family members and our neighbors. And so my goal is to bring as many services as we can sustain from the medical center into the local community, so that folks can get care close to home, not have to drive, and be near the ones they love. One thing that most people don't know about me is my background. So, I was not born and bred in healthcare, so I bring a very different perspective. I started my career in the ski resort business. I worked in law enforcement. And so I bring a variety of very customer-focused perspectives to how we deliver care. I tend to not call patients patients, I tend to call them customers. I think in today's day and age, people have a whole variety of choices about where they seek care. And I don't lose sight of that. I think it's a great honor that folks choose to come get care at Bridgton and Rumford hospitals, and my goal is to make sure that we earn that every day. And I also know that our employees have a lot of places that they could find work, and so every day when they come to work, I want them to be excited about being there as I am, and I'm grateful that they've chosen Bridgton and Rumford in central Maine to provide care, and so we try to earn their respect and earn that every day.